Hello, Abso family. My name is Raisa, and welcome back to another episode of Adults Need to Know. We are looking at the wellness wisdom doctors today, and I have one with me who focuses on women's health, and we're talking about your metabolism. So I'm going to bring her on, and let's give her a warm round of applause in the comments and the likes and the loves for Dr. Lucie. Hello, how are you?
Hi, doing wonderful today. Thank you for having me.
Thank you so much for joining us. So, Dr. Lucie, we always start off with one question on our show, and that is, who are you and what do you do?
Okay, I am Dr. Erin Lucie. I'm a family nurse practitioner. I am the beauty, body, and balance expert for busy women who want to look great and feel great and just take control over the world.
Oh my god. Yes. I'm intrigued. I want to know how to take over the world now.
Yeah, so really, I own a clinic in Tulsa, Oklahoma, anti-aging clinic, and we do all the fun stuff like Botox and filler and laser and making you look great. And then we also do women's health and like peptides and hormone replacement therapy. And we have a great program called the Metabolic Makeover, where we help you to lose weight and feel amazing, just kind of redoing your entire system like a reset.
Very cool. So
Yeah.
you're kind of telling me that losing weight has to do with like your metabolism. Could you kind of expand on that? Like what's the process? How does that happen?
Yeah. So what I've noticed, this is my 20th year doing aesthetics, and I didn't start out in weight loss. I started purely in aesthetics as an esthetician, and really what I've noticed over the years is that a lot of women are struggling with their weight, especially patients I've seen time after time, and can see their weight go up and down. And myself personally, weight goes up and down in pregnancies, and one of the big things with that is your metabolism and your whole your whole metabolic system and all of your hormones and your endocrine system and how is everything functioning together. How are you monitoring your blood sugar levels and your blood pressure and your thyroid and your hormones, and everything just kind of functions together. And I think that's kind of a big piece. Is sometimes with weight loss, we some clinics are, in the past, they used to focus on, let's just look at the pounds and you eat less and you exercise more. And that's not really how we do things now. So it's interesting to see kind of how things were 10 years ago versus how they are now, and the better knowledge and technology that we have to really kind of you know, help your weight move faster and not only just lose weight, but really kind of balance your hormones and improve your metabolism so that you're using that energy appropriately. And it's not just eating less calories and more exercise more, you know?
Yeah. And part of and this is what's so crazy is that part of what you're talking about and what you're saying right now is actually in our book that we just launched. So that is the Wellness Wisdom book. Could you tell me a little bit about your chapter and why did you decide to write a book?
So I think it's always, I don't know, I feel like it's everybody's dream to write a book, maybe. It's on your list of things to do. And I know that as a provider, I see several patients a day, and sometimes I'll say the same thing again and again and again, and because everybody needs to hear it. And the book is a great opportunity to say that same thing all at once to multiple people, kind of all across the world. And so that's what I think is beautiful about having a book and having that chapter available. To all my patients or potential patients, they kind of get to know, the background and what I do and how I do it, and that kind of philosophy. So I I've enjoyed writing that book. It's kind of something I've done, I'd say, like low key, because a lot of patients were like, "Oh my gosh, I didn't know you were doing this," and it's like, yeah, just on the side in my free time, which never happens. But it's been a lot of fun working with the other doctors in there, and because everybody kind of has the same philosophy and mindset and mission is to really help patients out there.
I love that. It's so wholesome to see and to speak with doctors that are just like, I love my patients because I know
Yes.
some doctors can be like a little bit scary. So it's just really nice to see that you truly care about your all of your patients. So we do have a few viewers all busy, hardworking women on Instagram. We have Melanie from Crossable Health, so she's also your co-author. We have
Hi,
Queen
Melanie.
Susie. We have the purest love of all. We have Shireen, and then we have Latifa Baksh. Hello, ladies. So these women that are watching right now, and for men as well, they are busy, hardworking moms, aunts,
Yes.
sisters. What are some of your tips for them in terms of balancing hormones or increasing their metabolic health in a good and strong way?
Yeah. So that's something that I wrote about in the book. Is I feel like I kind of wrecked my metabolism when I was going through residency, and really because I was working so hard and I was working in my practice and then also working on another practice in residency, and it's super important to eat very healthy and very clean because during that time I was living off like gas station food and burritos and chips and energy drinks and candy and just trying to survive. Because when you get that stressed and that busy, your body kind of craves those things, like sugar and the unhealthy fat or carbs that your body thinks that it needs for the energy, but you need to kind of take a step back and take a break and do deep breathing. And so there's lots of techniques that you can do for relaxation and just kind of, deep meditation, deep breathing, getting good quality sleep at night. And I know it's so hard. I said to my mom the other day that every mom needs to have just a break and a moment of silence. And she was like, yeah, good luck with that. And it's true. I have 3 kids and it's like it's so hard to take that moment and take that time for yourself. But as far as how do we balance our hormones, we only produce our hormones really like reset our mind and our hormones while we're sleeping. And so that's why they call it beauty sleep, is because you're going to produce your growth hormones and all of your healthy hormones while you're sleeping. And so having good quality sleep throughout the night is super important to get your hormones rebalanced. And then I think another thing that's kind of hit our society more so the past 10 years has been, I think that they say, don't eat a lot of fats in your diets. And really, and if you're looking at the hormone cascade, the very first thing that you need is healthy fats to make your hormones. And if you have a low fat diet, then you don't have the proper nutrients that you need to actually grow and build those hormones. And your hormones are your messengers that tell your body to grow muscle and tell your brain when to activate. And you need your hormones for everything all the time. And so when you're not getting a healthy diet during the daytime and then you're not getting that healthy sleep at nighttime, it makes a huge, huge impact on your entire body, how you look and how you feel. So those are my 2 biggest suggestions: is get some healthy fats, avocados, olive oil, fish, if you can eat fish, nuts and seeds, all of those healthy fats, and then get as much sleep as you can on a good, consistent schedule.
Oh my gosh. Okay, I have 2 follow-up questions for that because I
Uh-huh.
hear this all the time about sleep, that the optimal time for your REM sleep is between, like, 1 and 4 AM. Is that right? Is there, like, an optimal time for you to fall asleep for your hormones to work?
So the optimal time is kind of based on your time zone, but the optimal time would be when it gets dark to when it gets light. Because we produce a hormone called melatonin, and your melatonin is whenever it gets dark, your melatonin will increase, and that is what helps you go to sleep and stay asleep. But now when we have the time change and daylight savings time, now it gets dark at 5 o'clock where I'm at, but I might not go to bed till like 10 or 11 or 9, and I've already missed that window of melatonin. So that might be something I need to supplement in the winter time, but not necessarily in the summertime. So those are things to look at, but you just want to get sleep whenever you can. But definitely you want to be asleep during the 1 a.m. and 4 a.m. for sure, because that's when your body will be in its deepest sleep.
Mm. What do we do about the night owls then? I used to be a night owl. What do I do? Do I just, like, close the curtains, pull down the blinds?
Yeah, close the curtains. My husband is a night owl, and so this has actually been one of our, like marital struggles, is because I always say I'm a daytime person. Like I'm not a morning person. I'm not a night person. Like I'm like a like
In the
9
middle.
a.m. to 9 p.m. person. But there is a great device. I don't know if I'm allowed to talk about other devices, but there's a great device called Happy, Happbee. And I purchased one for my husband earlier this year, and it actually changes your brain waves, and it will simulate like melatonin, like the hormone melatonin, without you actually taking a pill. Um, so it's really awesome because he puts that, it's like a little necklace that you wear.
Mhm.
He puts that on and then he turns the app on his phone, and then he's able to go to sleep at a normal time without taking any sort of pills or medicine. And then in the morning, you can actually put it on awake and it'll be like your coffee or caffeine without actually drinking coffee, because I know a lot of people, that coffee can cause indigestion and heartburn, and sometimes you don't want calories in the morning or you're fasting, all those different variations. But it's been a really awesome device because you put it on your mood, or you want to sleep or you want to wake up, and you don't have to have any external stimulants or anything to
Mhm.
do that. The other tip I tell patients is to get, there's blue blocking glasses. And the blue light comes from our phones and from the TV. And that light blocks out our natural melatonin production. So it's always helpful after like 5 o'clock at night, if you're going to be watching TV or on your phone or in front of your computer,
Mhm.
even lights just like this, is to put on your blue blocker light, and it will help to um, help your own melatonin kind of increase on its own.
Okay. Okay.
Yeah.
I love that. Yeah, I always kind of hear that optimal time and I'm just like, is it true? I don't know. I don't know. But yes, you are right, especially like the blue light glasses. I think they're
Mhm.
very helpful. So my next question does have to go with also back to your chapter as well, talking about hormones. In what ways do women's hormones scream at them for help or like talk to them? Because I know sometimes we can like ignore the signs till it's a little too late, but it's never
Yes.
too late.
Yes, it's never too late. There are as it I think the biggest thing is sometimes you don't realize that, your hormones start to go down. In women, the first hormone that typically starts to go away is our progesterone level. And progesterone is what helps to keep us happy. We call it the happy hormone. So it makes you feel good, makes you feel like everything is okay and you're kind of in like a good spot. So it also helps to prevent breast cancer and fight Alzheimer's, and it's just very, very healthy and very good for you. And that unfortunately is the very first hormone to go away. And then, so with that one, you're not really like noticing too much other than maybe I'm not as happy as I was, or, is this depression? Signs of low progesterone can be depression. And sometimes people will go on antidepressants instead of just replacing their progesterone level. And so if you take an antidepressant for that, then you're not replacing your progesterone when you do need it to prevent all these other bad health things from happening down the road. So that's something that I check in patients if they're having feelings of depression or anxiety, is making sure that their progesterone level is optimized. The next hormone that we see go away in women is testosterone, and testosterone is in men. In men, the range is a lot higher, so the range is like 300 to 1200. In women, the range is 12 to 100, 120 maybe. So we don't see as much of that testosterone, but you might say you don't have as much energy or as much focus. Let's say you exercise frequently, but you notice that you don't really have, like, you can't maintain the muscle tone now that you used to have.
Hmm.
So that's what we start to notice with testosterone going down, is that you're not maintaining that muscle tone. Sometimes it's also feelings of depression. It's interesting. Testosterone is more like it helps you to see into the future. And I think that's one of the reasons that, I don't want to say that men dominate the field of architecture, but in an industry where you have to like make something out of nothing, I would not be able to create a building or design a building in that way. But that testosterone gives you that ability to kind of see into the future and fight feelings of hopelessness. And I think that's why, men have a really high rate of suicide once their testosterone drops. And if you don't have that testosterone, you don't have that ability to see into the future and kind of have that hope. and kind of put things together in that way. So estrogen does our multitasking left and right, and that's why women can do anything all the time. But testosterone helps us like see into the future that way. So those are the things we look for in women with testosterone. And then estrogen is our main hormone. It's our superpower hormone. And, like I said, it helps us to do everything. Um, and that will be the last thing that will start to go away because your testosterone, your progesterone will go away first. And then your body can't build its estrogen if it doesn't have those hormones. And if our estrogen gets high or stays where it is and our progesterone and our testosterone will get lower, then what'll happen is it's called estrogen dominance. And what happens with that is you'll start to gain more weight, like gain weight around your belly, gain weight around your thighs. And then you can also become more emotional and more moody. If your estrogen gets low, like what we start to see in menopause, then you'll start to get hot flashes, vaginal dryness. Your skin will get really thin and dry, and that's when we start to see wrinkles. And then you can also get like some bone loss, and also with testosterone, you can get bone loss. So you start to see more of those physical things start to happen when our estrogen starts to go
Hmm. Now, okay, one, that was really, really helpful. Thank you
down.
so much. I'm imagining now looking into the future of like our caption for the video, and it's like, "Is your testosterone down? Is it going? What can you do?" But I do.
Yeah.
There's one question in our Instagram chat is, what was the name of the first melatonin device? I think the one that your husband wears around his.
Oh, uh-huh. The Happy, HAPBEE. It's kind of like Happy, but with their logo is actually a bumblebee.
Oh, so HAPPBE? Sorry?
HAPBEE.
B BEE. And Shireen says, yes, very helpful. We are glad that you are enjoying this. So now that we're talking about three main hormones, how do we combat them? How do we, what's the solution to keep them all balanced?
So I would say first have them checked so you know where you're at. And this is very important because if you're having cycles, you want to have, sorry, I have this crazy hair. You want to have them checked on specific days. And with women, we like to have your hormones checked on day 3 and around day 21 if you're having cycles, because that tells us the range. Because your hormones they don't stay the same every day. Like with men, they're pretty much like the same for days and weeks and months and years, and they slowly go down. With women, your hormones are changing like every single hour. So we have to test them at specific times. We try to test them before 10 a.m. on day 3 of your cycle and then day 21 of your cycle. And this will tell us where your estrogen and your progesterone are and what is their ratio, how are they going to balance out. And then if you're in menopause or you haven't had a cycle in a long time, then we can assume that your estrogen isn't there because that's what's going to create your cycle. So we would assume that your estrogen is low. We just need to find out where your progesterone and testosterone, how low your estrogen is. So in that circumstance, it doesn't matter when we test the hormones, but testing them is very important to know that balance or see if one is really high or really low.
Mm.
Um, and then from there, we look at lifestyle modifications. Like I said before, eating a very healthy diet full of healthy fats, very clean eating. And then there are like specific foods like broccoli. Broccoli helps to pull out the bad estrogen and like bad estrogen that we would get from water bottles or plastics, things in the environment that aren't good for us, like synthetic estrogens, and sometimes they're on birth control pills and all kinds of stuff. Yeah, so broccoli will help to pull that out. And then, so we just kind of look at healthy diet and food and how do we balance those. And if that doesn't work, then we'll go into supplementation with topical hormones or whatever we need to.
And to get it tested, you just go to like a walk-in clinic, your family doctor, a specialist. What ways can you get that tested?
Yeah, so you can get it tested from your family doctor, or there are clinics in, probably in your town. There seems like there's several clinics that you can just walk in and order your own lab work. Sometimes with hormone testing, it's a little bit more involved. Uh, we like to do like saliva testing or urine testing if we're looking for something specific, like how you're metabolizing uh, your uh, if you're taking hormones, sometimes how you're metabolizing the hormones. So you can order those. There's a lab called ZRT that's really great. That one you can go online and they'll work with you with a physician to have that order. That's a saliva test. So you can actually have it shipped to your house, and you spit in a little tube and then you ship it off, and you'll get results in like 3 weeks. Some pharmacies that make hormone replacement therapy, they will provide testing. They don't have physicians. It depends on what state you're in. Some
Mm.
pharmacists can write for hormones, but other states can't. So it just kind of depends. But I recommend a hormone specialist because I know that sometimes it's not something that we learn in school. It wasn't anything that I learned in school. We learned how to write prescriptions for birth control. And we learned how to do ablations and, tubules and things like that. But it wasn't ever like, oh, let's actually optimize and fix your hormones instead of, let's give you birth control pills and shut them down. So it's a little bit different if you go to a hormone specialist because we focus on how do we optimize and replace these hormones that you're losing instead of let's just do nothing about it. So,
Mm, very interesting, very interesting. So instead of I really like how you said, that the birth control pills actually shut down the hormones in a way. So, like, do you experience that a lot in your clinic? Like, are you allowed to kinda talk about that?
yeah, I think that, with birth control, you're trying to get your body to not ovulate so you don't get pregnant, right? So,
Mhm.
like I said, like if you're having a higher estrogen, your estrogen's going up and down and your progesterone's going up and down, they kind of go in a curve if you're looking at your cycle on the chart. What the birth control pills do is they actually lower or suppress your progesterone levels, which is why you can feel kind of crappy or moody, and then they lower your estrogen levels so where you're not ovulating, you're not getting a healthy egg. So they are suppressing those hormones, and then depending on which type of birth control and how your body's responding, sometimes it will lower your testosterone levels, especially the ones that are really more for acne, that help with acne because of lowering that testosterone level. And then there are other kinds. There's some people will have a response where it will increase their testosterone or another hormone called DHEA. And DHEA is like a precursor or a prohormone to testosterone. It just happens before testosterone. And that can create what we call like induced PCOS, which is polycystic ovarian syndrome. And so it mimics this disease to where it's very hard to control, and that PCOS can actually make your blood sugars higher, and then you start to gain weight. And so we do see this sometimes in birth control pills, is that it's creating where that you're not having your hormones and you can't ovulate and you don't feel good, and then it starts to increase your blood pressure, not your blood pressure but your blood sugar, then you start to gain weight whenever you're on the birth control pills, and it's just this cycle of craziness.
Mhm. Wow, and then, like, so if we can't get to an awesome doctor like you, and if women are very busy, what ways, holistically can you kinda help yourself or address your own testosterone and estrogen? Is it, like, vegetables? Is it exercise? Is it meditation? Or is it all combined?
It's all combined. Sleep is the first thing that you need. The next thing is very healthy diet. The more fruits and vegetables, and specifically vegetables, are what create very healthy hormones. So healthy fats and a lot of green vegetables are going to be the best things for your hormones. And then really kind of understanding, how they relate together and having them balanced, but like just watching out for, if you feel super moody, or if your spouse or your partner says that they've noticed a change in your mood, like sometimes that's a big indicator that something is wrong with your hormones. So just kind of paying attention to yourself and what your partner or your people around you are saying. um, the other thing I would recommend is, like you said, meditation. The people that live the longest are the ones that meditate. And The reason is because it decreases your stress level, and stress increases your cortisol level. And if we go back to that original hormone cascade that I was talking about, where you have your progesterone, testosterone, and estrogen, before your progesterone, over here is like the cortisol hormone, which we don't really use it unless we're stressed. But if we're having that healthy fat and then we get stressed, then it's going to go over here to the cortisol instead of your other hormones. And so what will happen is all your hormones suffer whenever you're having that stress and anxiety. And it's not going to happen overnight like you have one stressful event. But for somebody that is chronically stressed, and for those of us that are workaholics, it's a little bit, crazy, because you do have that high stress every single day. And eventually your body will build more cortisol. And then that cortisol, because it's a stressor, it makes you kind of increase more sugars, and you have higher insulin levels. Then you'll start to get abdomen, like weight around your belly. So it just starts this snowball effect. So managing stress, which will decrease your cortisol levels and help kind of balance out the other hormones, that's very important, is managing stress with that too. Meditation is a great way. Journaling is a great way to do that. Taking a break, and really just thinking about, what's important. And that's why I like to, journal and write things down. I think for women, sometimes we have all these thoughts in our mind before we go to bed of what needs to happen. And if you can write those down and make a list, that really helps to get them off your mind and on paper and just be done with it.
Mhm. Okay, I love that. For our women watching, you are getting a lot of love on Instagram, Dr. Lucy. They're, like, sending, like, the little hearts
Aw, well,
on
thank
the.
you.
Yeah, if anyone has a question, make sure you type it in the comments so that we can read it to Dr. Lucy. Dr. Lucy, thank you so much. So in your chapter as well, you talked about the beauty of it all, and you had some like client stories. So like, what's the best story that you've had from a client so far in terms of the results, in terms of like higher self-esteem, better hormonal balance? Is there any story like that that you could share with us?
I think that, gosh, I feel like there are so many stories. I've been doing this a long time. There are so many stories, but my favorite would be, I had a patient that came in, and just for something simple, she just wanted some like Botox here and her forehead. And, and you think, oh, Botox, like whatever, it's like no big deal. But she actually said that, her husband abused her, and she was like hiding in the closet and she was crying. And that's what those like forehead lines kind of reminded her about. And she had like some acne scarring, and um, so it's interesting that once we got rid of the Botox, like of the frown lines with the Botox, she just really kind of came to life. And that the memories of the abuse helped fade away. And then we started to work on the acne scarring, because she was saying that she would go to bed with makeup on, and then so he wouldn't see her. And then the next day she would wash it off after he went to bed, and then wake up early and put it on before he went to bed or before he woke up. And so it's this constant cycle of her trying to please him. And so, we cleared up the acne and got rid of the wrinkles, and she just started to just really like blossom and look better and feel better. And, now she's like dominating her job because of all the confidence she has, and is just doing her own thing. And so that's been really excellent, is to just see her so empowered and happy with herself, and just taking care of herself. Yeah.
Mm. Oh, that is now that is one beautiful story. Thank you.
Yeah.
What do you think about the stereotypes or negative stereotypes against plastic surgery or even the taboo of it? What's your opinion on that?
I think that I always want to say, you do you. And if it's something that bothers you, when I do a consult, the first thing I ask you is, what do you love? What do you love about yourself? Do you love your eyes? Do you love your lips? Like, do you love your hair? And we really focus on what do you love? And then we look at, what bothers you every day. And because I know for myself, I actually had a breast implants done, and it was something I thought about every single day. Like, I had to get my clothes tailored, and, my scrubs didn't fit and my clothes didn't fit. And it bothered me every day. And once I had them done, I never think about them. It's like a part of me, and I feel the way that I should feel now. And I never think about it. Like, if you asked me if I had my boobs done, I would be like, oh, I don't know. Maybe I did. Like, it's not something that I think about. And so it's nice just to have that done and off of my mind so I can focus on work or patients and, things like that. So I think that's, with women, it's like just do things that make you feel your best. Because if I feel my best and I feel confident, then, my daughters are going to see that I'm confident in my body and, how I present myself. And then they're going to, I can show that to the women that work with me. And it just kind of ripples out from your confidence to your family and, your work life and your community. So I feel like it's not just Botox, or just plastic surgery. You're really kind of just tweaking things that bother you so that you feel your best, so you can like work your best. I know I have a sister that's 8 years younger than me, and when she was in college, my one tip to her was, if you have a test in the morning, you got to get up, do your hair and makeup, just look good. Do not go in your pajamas. Like, you need to be your best self. And I feel like, when both men and women, when you feel that way, when you feel your best self, then you're going to, do your best at work and whatever you do.
You're right, you're right. Latifa agrees with you as well. She says, "That's so awesome." Thank you,
Thanks.
Latifa. Oh my gosh. So I really like that because, my mom actually tells me the same thing as well. Like, when you're feeling bad, it's just like, pull yourself together, and not mentally, but just do it physically, like brush your hair, put on makeup, do what you have to do to make yourself feel as confident as you can be. Dr. Lucie, where can people find you? How can they find your clinic? Where do they follow you? What's your social media?
Yeah, so I think everything is under Dr. Erin Lucie, ErinLucie. And I have a website, drerinlucie.com, and I'm on Facebook and Instagram. And then if you're in Oklahoma, I have an office, like a physical location in Tulsa, Oklahoma, in the beautiful Midtown area called Luminate Clinic.
Ooh, fancy name.
Yeah,
Why'd you name it
yeah.
Luminate Clinic?
So my last name is Lucy, and that comes from, my husband is Italian descent, and their name was originally Luminato, I think. And so it just means to enlighten and really kind of, bring light into your life. And so we kind of shortened it and made it Luminate. So we want you to shine bright.
Oh, I
Yeah.
love that. I love
Yeah. It's fun.
that. Well, Dr.
Thank
Erin, Lu
you.
have definitely enlightened us all today, especially for the women who are watching right now. Thank you so much for watching this, and thank you for enlightening us about hormones and body and beauty and just being your best self. I think every once in a while we definitely need that kind of confirmation, or just even from a doctor herself, the scientific information to say that yes, we are doing well in life. Yes, we can improve. And you know what? Yes, we can enjoy ourselves to the fullest. So I just want to say thank you, Dr. Erin Lucie, for coming on to the show. And if you want to
Yes.
read her book, which I'm sure you will, it is with 15 other co authors on Amazon, called Wellness Wisdom. And yeah, thank you so much for joining me.
Thank you for having me.
No problem. This was presented by APSO. Awesome people shaping our world. Remember, you are awesome and you can make the world a better place. Bye.